welcome back at ECCMID TV, brought live to you from Pavilion 1 here at the ECCMID Congress Center in Lisbon in Portugal. My name is Judith Cohen. I'll be hosting these TV series broadcasts, and right now I'm very, very pleased to have a new guest with me in the studio, Professor Michele Bartoletti, who is actually the recipient of the Young Investigator Award for research in clinical microbiology and infectious diseases. So a warm welcome to you, Michele. And very much, a heartfelt congratulations on receiving this award and getting this acknowledgement for your outstanding research. I understand that you do have your main research focus on critically ill patients, immunocompromised hosts, and patients with liver cirrhosis. And that's also the topic of the talk you gave during the award ceremony, right? Let me just look it up. It was Epidemiology and Clinical Management of Infections in Patients with Liver Cirrhosis.
Correct.
So how was the ceremony? How did you experience this?
First of all, thank you very much for this invitation. I'm very happy, very pleased to receive this award because I think it's very prestigious and considering the importance of the ESCMID as a scientific society on the topic of infectious disease. My field of interest and my talk was on, as you said, an epidemiology of liver cirrhosis, infection and liver cirrhosis. And this is based on a series of studies that I've performed in the last 5 years in this field, based on epidemiology of infection in terms of which kind of infection and especially which kind of pathogens are typically involved in this kind of complication of patient with liver cirrhosis, and especially what is the role of multi-drug resistant pathogens. That means that pathogens that are resistant to antibiotics in this population, and we found that this population are typically very afflicted by drug-resistant pathogens. This is very important when...
So which pathogens are
usually
most
gram-negatives.
Sorry?
Gram-negatives.
Gram-negatives.
Yeah. That brings resistance to several antibiotics. This is very important because, as you know, when we treat patients, we need to select the correct antibiotics, and if we have to deal with drug-resistant pathogens, the chance to have an effective antibiotics is lower. Then we performed other studies on risk stratification and risk prediction.
So predicting which patients with cirrhosis are more at risk of...
of both having an infection caused by multi-drug resistant pathogens, or which scores that we have that we can perform this patient better predict the mortality in a short-term period and a long-term period. This is very important for this population because patients with liver cirrhosis typically have an end-stage organ disease, which can be saved with liver transplantation.
And which characteristics help predict the risk these patients have? Are there more clinical characteristics or biomarkers? Can you comment on that?
Typically, these patients have an acute decompensation of the disease, which brings them to the hospital. When this acute decompensation is complicated, or what we call acute on chronic liver failure, which is defined by some scores based on laboratory findings, the mortality is very much higher. So when we use this stratification, and especially in patients with infection, we can select which patient can be a candidate for liver transplantation, and start this pathway for the patient to bring them to a life-saving solution.
Yeah. And after the liver transplantation, there's a whole lot of other pathogens
Yeah.
hoovering
In fact,
over the
this is
patient.
very
Yeah.
important, in my opinion, that an infectious disease specialist can follow the patient from the stage of liver cirrhosis to the liver transplant and after transplant.
And after, yeah.
And obviously there are some subspecialty of infectious disease that typically are engaged in this.
Yeah. So now you have the risk stratification, and you know how to work up patients in the best possible or the optimal way towards a liver transplant. Are there still unmet needs? What is your research going to be focusing on there for the next couple of years?
Yeah, there are many things that we want to continue to explore. One is the problems of invasive fungal infection in this population, especially there are some studies that seems to says that there are a higher risk of invasive fungal infection in this population. However, they are sparse, a very, very small case series, so probably we will need a large study on this. And then other things very important is to better know the pharmacokinetics and pharmacodynamics of antibiotics in these patients, because liver cirrhosis is typically associated with a complication that is ascites. Ascites is like a fusion in the abdomen of fluids.
Yep.
And this typically increase what we call the volume of distribution of drugs.
Yep.
And when we use
so you need to really taper the drug towards the individual situation, because
So we need to work also with clinical pharmacologists and to help us to select the proper dosages and the way of administration of drugs in this population.
Yeah. That's interesting, yeah. And do you see any hurdles or challenges while you want to research this? Or is it just getting it done?
Yes.
Yeah.
Just this.
Besides taking care of the critically ill.
Yes. Of course. Yeah. Obviously, the infectious disease is unpredictable, as we know. Yeah. So things can change rapidly. So also we have to be prepared to what the world brings to us.
Yeah.
So this is the main challenge for us.
Yeah. And you also told me that you were on the guidelines committee for how to management of COVID-19.
Correct.
You still is this in the same time period that you managed to complete all this research on the patients with liver cirrhosis? You didn't neglect the liver cirrhosis.
To be honest, in the last two years, as anyone, have to focus also on COVID-19 in terms of clinical duty, research, of course, because it's something new that we have to understand better. And so what I've done some studies on COVID-19 as well, especially in invasive fungal infection, complicated patient admitted to the ICU in a patient with COVID-19, and I was the chair of the guidelines panel on treatment of COVID-19. This was very exciting for me, but in the meantime I had to stop what was doing with patient with liver cirrhosis.
Yeah, I can imagine it's been fully packed, tough years, I guess.
Yes.
Yeah. So you'll be presenting other research as well this ECCMID. Am I correct?
Yep. Yes, correct.
Is it also research on patients with liver cirrhosis, or?
No, we have some small studies on bacteremia, patient with bacteremia, and I've a presentation on pediatric patients with gram-negatives, multi-drug-resistant pathogens, which was a case series that we done in our hospital, and then another study performed on new drug to treat MRSA bacteremia.
Okay, interesting. Well, have fun and good luck with that. Thank you so much for coming here to speak with us here at ECCMID TV. We're very happy to have had you. Again, congratulations on receiving this very prestigious award. We will be tuning out again now with ECCMID TV, but we will be back with you at 11 sharp, when we will be having as our next guest Annelies Zinkernagel, who is the ESCMID president-elect. So we're very interested to hear from her what she has in store for her upcoming years as president of ESCMID. So please don't miss out and tune in with us at 11. See you then.